Hello friends, welcome to Expert Medical Coding. In today's video, we're going to cover 3 coding clinics. The first one is constipation with fecal impaction. Second one is complication of deep inferior epigastric artery perforator flap. And third one is deep inferior epigastric perforator flap failure. So let's get started with the first one, that is constipation with fecal impaction. And the question here is, the provider documented both constipation and fecal impaction on the same encounter. There is an excludes one note for subcategory K59.0 constipation under code K56.41 fecal impaction. So as you can see, under code K56.41, there is an excludes one note constipation. There is also an excludes one note for code K56.41 under subcategory K59.0. So as you can see, under code K59.0, there is an excludes one note for fecal impaction. So the question here is, which code should be assigned? And the answer here is, assign code K56.41 for provider documentation of fecal impaction and constipation. Constipation is integral to fecal impaction. Chronic constipation can result in fecal impaction when a hard mass of feces becomes stuck in the colon or rectum. Fecal impaction is a more severe condition, and if left untreated, can lead to serious problems. Now, before moving towards the next scenario, let us first see what is deep inferior epigastric perforator flap is. A deep inferior epigastric perforator flap is a type of breast reconstruction surgery that uses tissue from the lower abdomen to rebuild breasts after a mastectomy. The procedure involves removing skin, fat, and blood vessels from the lower abdomen and relocating them to the chest to reshape the breast. The flap is supplied by the deep inferior epigastric artery, which has a long pedicle that provides healthy tissue. Now moving toward the next coding clinic. Complication of deep inferior epigastric artery perforator flap. And the scenario here is, a patient was admitted for breast replacement reconstructive surgery utilizing the deep inferior epigastric artery perforator flap. Subsequent to the DI-EAP flap procedure, it was noted that the patient had progressive swelling of the left flap, with venous appearing blood emanating from the Jackson-Pratt drains. There was an excellent arterial Doppler signal. However, given the appearance of the flap as well as the acute swelling, it was felt that this represented a venous thrombosis. The patient was given a bolus of heparin and underwent a venous thrombectomy and revision of the venous anastomosis of the left DI-EAP flap. Now the question here is, how is thrombosis of a DI-EAP flap is coded? And the answer here is, assign code T85.868A, that is thrombosis due to other internal prosthetic devices, implants and grafts initial encounter. Breast surgery utilizes a DI-EAP flap is classified as breast replacement reconstructive surgery. Therefore, it would be appropriate to follow the alphabetical index as noted below and assign the appropriate code within subcategory T85.86. Thrombosis due to internal prosthetic devices, implants and grafts, not elsewhere classified, to describe the thrombosis complication of the DI-EAP flap. Now let us see this in the index. Go to the main term thrombosis, under that subterm due to device, implants or graft, under that breast implant. So it will lead you to the code of T85.868. Now moving towards the next coding clinic, that is deep inferior epigastric perforator flap failure. And the scenario here is, a patient was admitted for a bilateral deep inferior epigastric perforator flap procedure following a failed expanded to implant breast reconstruction. The postoperative course was complicated by a left breast DIEP free flap failure, also documented as a non-viable breast reconstruction flap. The left DIEP flap was subsequently removed. How is DIEP flap failure coded? So the answer here is, assign code T85.898A, other specified complication of other internal prosthetic devices, implants and grafts initial encounter. Breast surgery utilizing a DIEP flap is classified as breast replacement reconstructive surgery. Therefore, assign the appropriate code within subcategory T85.89, other specified complications of internal prosthetic devices, implants and grafts not elsewhere classified, to describe the DIEP flap failure complication. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.